Good. Hi, how are you, everyone? My name is Dr. Karomibal Mejia. I'm an interventional cardiologist and endovascular disease specialist here at Ogden Medical Center. Today, we'll be talking a little bit about peripheral artery disease, so thanks for being here with us.
So, can you tell us what peripheral arterial disease is?
So, peripheral artery disease, in plain terms, just mean that the arteries and the veins from your body get narrowed by cholesterol plaque. The main difference between arteries and veins is arteries are the blood tubings that will take the blood from your heart to the rest of your body, and then the veins will collect that blood from your body and return it to the heart. So any process that will narrow those tubings, it's considered peripheral artery disease as long as it's outside of the heart.
So, I understand peripheral arterial disease is also known as PAD. So, what is the main cause? I understand it's cholesterol. Does that come from eating the wrong foods? What's going on there?
Yeah, so it's a great question. So the most common cause of peripheral artery disease per se, it's a process called atherosclerosis. So atherosclerosis just means that cholesterol plaque will build up in the inner wall of the arteries. That process can start as soon as the teenage years or in the 20s. However, depending on which risk factors we have, whether you have high cholesterol, diabetes, and smoker, that cholesterol buildup can accelerate in some patients more than others. In some other patients, there's less common causes such as blood clots. Sometimes trauma can impair the blood flow to distal organs. And some other more uncommon conditions, some patients will have some abnormalities in their ligaments or muscles, which will affect the blood supply, mainly to the legs.
So, is there a certain age group, or who's at risk of getting PAD?
Yeah, so that's I think that's the most important question of the day. So there's two components to that question. So one is there are certain things we cannot change. The main one being age. We cannot prevent getting old. However, we do know people who have uncontrolled diabetes and smokers are the ones who would be at higher risk of developing peripheral artery disease, people with high cholesterol levels as well, and people with sedentary lifestyles. So will be the ones more affected by peripheral artery disease. We know that 1 out of every 5 people above 60 will have peripheral artery disease. Around 20% of everyone above 60 will be diagnosed with peripheral artery disease.
Okay, so what are the symptoms? What should people look for?
So it's a difficult question to answer because around half of the patients won't have any symptoms of peripheral artery disease, and that's why it's so important to follow with your physicians so that we know those high-risk groups such as diabetes or smoker. We can give you a questionnaire in the office. Sometimes patients won't know because you're not walking as much. So we ask them a specific questions. The most common one is going to be leg pain when you walk. And where is the pain will help us understand where do we think the blockage is, whether the pain is in the thigh when you walk, is in the calf when you walk. Besides pain, you can also have cramping. Some people will come to the office and just say, the skin in my leg looks a little bit different from before, or my hair is not growing, on my legs, or I have an ulcer in my leg. So those are usually the most common. The main one is pain when you walk or you exercise, which will get better, when you stop.
Okay, so how is it diagnosed? If somebody just comes in, is there certain testing that you like to do to help figure it out?
The main thing from my perspective is to listen to the patient, get a history, see what are the risk factors that they have. For instance, if someone is 20 years old and have leg pain, then I would be inclined towards other diagnosis. However, if you are 70 and you have uncontrolled diabetes for 30 years, you have been a smoker, then it's a little bit easier, I guess, to to diagnose. So patient's history, do you like get leg pains when you walk? Do you have an ulcer? We do physical examination, and what do we look in the physical examination? We're going to look at your pulses, because we mentioned in the beginning that PAD is pretty much narrowing of your arteries. When I touch your feet, I'm looking for weak pulses down there. I'm gonna touch your skin to see if it's cold, which is a sign of poor circulation. Want to see if you have hair growth in your foot. So if all those things are gone, then we go to other testing. The most common one we do, it's called ABI, or ankle brachial index. It just means, in plain terms, we measure the blood pressure in your arm. Let's say it's 120. Ideally, in normal circumstances, we will measure the blood pressure in your ankle as well. We should be similar. So 120 and 120. However, if it's 120 in your arm and in your ankle is 60, so we know you're losing 60 somewhere down those blood tubing. So that's highly suspicious for blockages. Then we go ahead and do an ultrasound of your legs, and the ultrasound will help me to identify where that blockage is. If all that is positive, then we'll go ahead and do what we call a peripheral angiogram, where we put catheters in your legs and just take pictures directly to find the blockage and treat them if necessary.
Great. I know that you said about 20% of the people over 60 will be diagnosed with peripheral artery disease. So how common is it, say, under the age of 60? Is that anything that people need to worry about?
I think the main element in terms of PAD, that's just because we have this age component, right, that we cannot change. And as you age, other diseases will come up, right, such as high blood pressure, diabetes, and high cholesterol. However, we've had several patients in their 30s and 40s who develop peripheral artery disease. In their cases, not so much the age, but probably they had uncontrolled diabetes since they were 15 years old, or they have been smoking since they were 18, right? So if that's the case, then the process is going to start a lot sooner than 60. But usually 60, it's the cutoff that, if you're 60, even if all those things are under control, it means if you have been diabetes since you were 30, 30 to 60, 30 years of diabetes, right? Plus the age, plus the high blood pressure and everything. The main thing is to control those risk factors. That's the main thing that we can do as patients and as doctors to promote.
Okay. So does it run in families?
PAD per se does not run in family, but let's remember that what we spoke before about risk factors, right? So high cholesterol, we know it runs in family. We know diabetes runs in family. And so those things will promote the development of PAD. So, but the PAD process per se won't run in the family, but those conditions will, and then will lead to peripheral artery disease in the future.
So is there technically a cure for PAD?
Cure is it's a very strong statement. Even though we can cure infections, and maybe some cancers, there is no cure per se for PAD. Remember, this is a process that it usually takes 20 to 30 years to develop. So we cannot just, let the body do, what it's doing for 20 years and cure it, with one or two doctor visits. What we can do is prevent the disease from progressing, meaning if we're diagnosed with diabetes when we're 35 or 40, we're going to do whatever it takes to keep that diabetes, that cholesterol, that blood pressure, a smoking cessation under control. So by the time we're 60, the cholesterol plaque hasn't progressed as much compared to someone who didn't take care of themselves, to put it that way.
So what's the long-term outlook for anyone that's been diagnosed with it? You mentioned that you can stop its progression. Does that mean that maybe it won't get more severe? It'll, the symptoms will be a little better. What happens long term usually if you have PAD?
So it depends. It's a great question. It depends at what stage we diagnose the disease, right? a lot of patients, they need to be told, you have a problem, to make changes. It's very hard to make lifestyle changes when things look okay for you, right? A lot of people say, I don't have any problem. I won't go to the doctor because they will find a problem. This is one of the diseases that the sooner you find out, the better, because maybe everything is perfect, but we do an ultrasound of your neck or your legs, we find blockages, and then we'll tell you, you need cholesterol pill, because even though you're feeling completely fine, you have a lot of cholesterol plaque in your legs. So we're going to give you statins. We're going to change the way you eat so that we prevent that from progressing. A lot of people, sadly, shows up to the hospital already with big ulcers, right? Or we have to amputate the foot. So obviously their prognosis is going to be worse than someone that we're able to catch early. But the main thing would be prevention of controlling those risk factors that we mentioned early, so that we can prevent the disease from progressing. If we can catch the disease early, the prognosis is very good.
Right. So you just mentioned talking about doing some preventable things. So what are some of the ways that we can prevent getting peripheral arterial disease?
The main one will be to one, walk a lot. So we know, and in fact, once you're diagnosed, even patients with symptoms, exercise therapy is the best therapy. So a lot of people will say, well, I can only walk 2 blocks, and then my leg starts to hurt, I have to stop. And what is proven to be the best therapy is like what we call supervised exercise therapy. So we tell patients, you're going to walk until you get tired, and then you're going to walk a little bit more every time. And then patients will come and will say, you know what, I'm walking a lot more now after that. So moving, it's number one. If you smoke cigarettes, obviously stop smoking cigarettes. If your diabetes is not controlled, control your diabetes. The cholesterol is high, control the cholesterol. My job is going to be from procedure perspective will be at the end, if all those things don't work, and prevention, it's number one, is the main thing, and then procedure-based therapy will be the last option, and hopefully we don't have to get there. But the main thing is to prevent those conditions that we mentioned early. Yes, so thank you for joining us today in our talk about peripheral artery disease, and we hope to see you again soon. Thank you.